Hello, everyone. Happy Monday, and welcome back to another episode of the Dental Download Podcast. My name is Haley, and I'm your host. This week, we are joined with another guest. Dr. Nikhil Sharma is a dentist in Toronto, Ontario. He has quite a unique story from going through an accelerated dental program in Canada and then doing a GPR, which is a hospital-based program if you aren't familiar. And then he got into pediatric dentistry right away and did some teaching, did some work in the hospital, and now is working in private practice. So lots to be learned from Dr. Nick in this episode. But before we get into the conversation with him, I did want to do our typical little intro. And if you're listening to this real time on December 14th, I did just want to say good luck if you are a current applicant to the cycle and hoping to hear back from schools tomorrow. And I did also want to say that if you are a current applicant this cycle and have not had any interviews yet, do not give up hope and do not lose faith. Have trust in yourself and be proud of your accomplishments regardless of your status this application season, whether you're hearing from not your top choice, whether you're not hearing from anyone at all. I just really want to encourage you to be reflective, be patient, treat yourself with grace, and understand that you are not your application. If you want to listen to Dear Dental School Ashley's episode that was a couple ago, that could be really helpful because she gives some encouragement about how to separate yourself from your application. So that could really ease your worries right now if you're feeling stressed about tomorrow or just in general anytime you're listening to this episode. That's a really great one for pre-dental students to listen to in particular. But for me, I am heading into my last week of finals this week of the 14th. I have 3 finals left, so that means we have finished 9 of our 12 classes already, 3 to go, so I'm really excited about that. After tomorrow, when you're all listening to this, I will have 2 done, so I just have 1 left, which is on Wednesday, and then I have about 3 weeks off, so I'm really looking forward to that time with my family and that time to kind of reset. Again, I'm not going to get too into what's been happening just because I'm going to save all of that for the D1 fall recap episode, which is going to be up next week after this one. So I hope you're all excited to listen to that. I did want to throw in a little bit of motivation still this episode before we get into the conversation with Dr. Nick and then let you all enjoy the rest of that. So I don't have a specific quote or something as the motivation this week, more of just another kind of thought process that I want to share with you all. And that is just to remind yourself that you have it in you. Whatever you're working for, whatever you're worried about, whatever you're working for, just recognize that you have it in you. You're capable of anything that you set your mind to. I'm not saying it's going to be a night and day change. I'm not saying you're going to wake up tomorrow and reach all your goals, but slow and steady wins the race, and whatever you're working on right now, whether that's final exams, whether it's something. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Hi, everyone. So we have another guest today, and I'm going to let them introduce themselves.
Hi, my name is Nikhil Sharma. I go by the name of Dr. Nick in the clinic. I want to thank you, Haley, for, first of all, having me on this podcast, and I hope I serve of some help to your listeners and followers. I'm a pediatric dentist in Toronto, Ontario, and currently practicing completely into private practice as an associate.
Awesome. So can you briefly explain some of the differences between dentistry in Canada and the US? And then I know that you did like your specialty residency in the state of New York. So what made you, why did you have to do that? Was that a choice? Can you kind of explain some of the logistics of everything?
Of course, yeah. So dentistry in Canada and US, I don't know much about dentistry in the US other than what I've kind of learned off my friends, but In Canada, it is a 4-year program. We do about a year and a half of medicine in the beginning with the med students from our year. And then we complete the other 2.5 years in completely dentistry. So a little bit of pre-clinic with plastic teeth. And then the rest of it is patient care. Luckily, in the state that I'm from, which is Quebec, I did my dentistry at McGill University in Quebec. And there they have a 5-year program for those who want to go straight into dentistry. Obviously a little competitive. And once you get into that, you don't have to do a bachelor's prior to dental school. So I did not do a bachelor's prior to my dental program. I went straight into a 1-year pre-dentistry and then 4 years of dentistry after that. And then upon graduating, I did do a general practice residency at a pediatric hospital. And that's kind of pretty emphasized on at our dental school, at least in Montreal. And I did a GPR at a pediatric hospital known as Montreal Children's Hospital. Pretty much first 2 months, I kind of knew I wanted to do pediatrics for the rest of my life and decided to apply to New York. The thought process behind that was this pediatric program in Canada, majority of them, actually all of them are 3-year programs. They're a master program. And in the States, you can find some that are 2-year programs, and I guess the stipend and the pay is definitely much better than in Canada. So some of the reasons why I preferred applying to the state of New York, close to home, definitely different from Canadian dentistry. So I wanted to kind of get outside of Canada, get outside of what I was used to learning, and introduce some new things in my field.
Thanks. It was a really great explanation. So since you mentioned that you kind of got into dentistry pretty quickly with your accelerated program, when did you decide that you wanted to do dentistry? And then also when did you decide on pediatrics specifically?
So I think pediatrics came before dentistry. So okay. I wanted to be a teacher when I was young, probably as a kid. I always saw myself being a teacher, wanted to work with kids, wanted to always be around kids. And I think soon enough, I realized healthcare was important to me. Science was important to me. Definitely with my cultural background, my parents kind of emphasized on the medical career as well. So I wanted to be a pediatrician for, I would say, majority of my youth. When I started volunteering at hospitals versus dental clinics, I realized that the lifestyle that I kind of wanted for my future was more of a dental type of life. And pretty much, I'd say within about a year of volunteering, I realized that I did not want to go in the medical field and wanted to do work as a dentist. And as I started dental school, I wanted to do either ortho or pediatrics. Either way, I was going to work with the younger population. And towards the end of dental school, I got really exposed to working with kids, working with patients with special needs, patients with autism, and I happened to be good at it. So a lot of my teachers and administrators told me this is definitely something you should pursue. So applied into a pediatric GPR, enjoyed it, and then went to pediatrics, never looked back.
Great. And another thing I was hoping to hear about is your experience in dental school specifically, and then anything you think you did during dental school that helped kind of further your knowledge about pediatric dentistry.
Yeah, so dental school was great. Definitely, I went straight into university for dentistry. So we had some individuals in our program that were obviously from bachelor's, had university experience. So I was kind of pretty young into university, trying to make the most of my dental school experience. Learned a lot. Did not have as much experience with research, maybe compared to my classmates. Got a little bit about that when I was in dental school. And I think towards second or third year, end of third year, we had a summer clinic where we did a month of clinic work during the summer, over the summer vacation, and we did it with the younger population. So anyone in the teenage years, even kids within 7 to 10 year range that were fairly cooperative, and we would treat them over the summer and pretty much just complete all their dental needs. And I think that's when I really got exposed to pediatrics and realized, yes, these kids were more cooperative than the general population, but it was definitely my first exposure to kids in the dental field, and I loved it and I enjoyed it. And I didn't really do a lot in terms of educating myself in the pediatric field until that end of third year. And that's when I started looking more into pediatrics. I started shadowing at orthodontic clinics as well as pediatric clinics, and just that's it. That's pretty much what I did. Not too much CE. I feel like now there's more pediatric continuing education, whereas back then it was more implants, more pros, more dentures and all that kind of stuff. So I didn't really pursue that very much.
Yeah, so continuing on in your journey, then after dental school, you said you entered the GPR and then the specialty program. Can you talk a little bit about how your specialty program was structured? Are there differences between the 2 years of your program?
Yeah, for sure. So it's a 2-year program. It's not a master program. The first year usually is trying to get your pediatric knowledge up to par, I guess, and then also building up your speed. So the biggest thing in pediatric dentistry is the speed in which we do our treatments. The faster, the better for the child. So the first year was focused definitely on treatment planning, on learning the pediatric knowledge, as well as just providing basic treatment procedures. So getting comfortable with providing those stainless steel crowns, those pulpotomies, and various other pediatric treatments. And the second year is when we started doing more sedations, general anesthesia, operating room, more rotations as well, kind of learning about community dentistry, learning about general anesthesia in the hospital environment. We actually had even an anesthesia rotation where we worked with an anesthesiologist to intubate as well as provide IVs. Definitely a lot of learning. And then there was definitely enough experience over the 2 years, spread out over the 2 years, to learn all aspects of pediatric dentistry.
During that program, did you feel like the day-to-day was similar to what you do in like private practice, like about the same number of patients, or was it still slower since you were in like more of a learning stage?
Yeah, I think it started off slower. Definitely, within the first year, they're not booking us as many patients as I get private practice was, but by the end of second year, I would say we're pretty close to private practice. Definitely, once you're in private practice, you figure out ways to make yourself faster, do certain reorganization and restructuring within the clinic, which we couldn't necessarily do as part of a residency, but kind of just structuring your day a little bit different, running different amounts of chairs, having another room to go into, that's not something that's possible always during a residency. So speed definitely picked up throughout the residency. And then finally, when I got into private practice, I just kind of made some modifications to my organization and was able to see more patients.
I know that you said you also were involved as a program director at that same GPR program that you attended. Can you talk a little bit about how you got involved in that role?
Yeah, so that was completely random. I never thought of ever getting into academics after completing my pediatric residency. I happened to be visiting Montreal, visiting the hospital, visiting the GPR program, and just kind of saying hi to old friends and staff. And I thought maybe, I would consider maybe an afternoon to go supervise, demo the residents and just teach maybe an afternoon a week. And when I was there, they told me they were looking for a program director, preferably, a pediatric dentist, even though it was a GPR. Because it was in a pediatric hospital, they wanted to definitely get a pediatric dentist. They really liked my experience with them in the past, so they offered me a part-time program director position. I had no idea what that consisted of. Sat down with the previous program director and found out that maybe this is something I want to get into, and this opportunity doesn't come around very often. So I went ahead with it and did that part-time. And part-time, I got to work in a private practice in Montreal as well. So it just happened to work out on its own. Literally, I take that as a lucky opportunity, but I definitely learned a lot, and I would not trade it for the world. So it was a good experience.
It seems like that would be kind of a nice balance to your week, like kind of two different hats, that you were the academic duties and then also the private practice duties. What was like a day-to-day like when you were working as the program director? What kind of responsibilities did you have?
Yeah, so definitely a balance throughout the week. The week was, just to speak of the week, it was completely different. Every single day was going back and forth. So either hospital dentistry, either teaching, either private practice. A good variety, which made the week go by so much faster. But day to day at the hospital was start in the morning teaching. So we did morning lectures to the residents, and then they kind of saw their patients and just supervised them with their patients, attended for emergencies, traumas, saw a lot of patients with syndromes, got to see a lot, got to learn a lot as well while teaching myself. and did a lot of hospital dentistry as well. So we had to kind of sometimes get up and okay, we have an emergency in this ward, this and this department needs us. So it was never the same day. Every day was different. Patients were obviously completely different, but even just the structure of the day and the schedule of the day changed on the fly. Sometimes running as an emergency into the operating room because a child needed to have an extraction done was not part of the plan in the morning, but by the afternoon, that's what we were doing. So very interesting day, very fun day. It made the hours go by really fast. And teaching new graduates is always fun because they come in with, so much, I guess, information and education already, but they also have so many more questions. So it makes you think, it keeps you on your toes, and you kind of go home that same night, do your research, talk around, and then try to get answers for them the next day.
That is really cool. I feel like that's such a unique experience. And like you said, it just kind of all happened, which is really great. But now you said you're fully working in private practice, correct?
Correct. Fully into private practice.
Okay. So can you talk a little bit about that work now? Maybe like what are some of your favorite procedures to do? What does the day-to-day or maybe week-to-week look like?
Yeah. So I happened to come into a situation where I got offered to work in a private practice with multiple practices. And it's not something, again, that I was planning on doing this soon. I was kind of looking at something outside of academic eventually. It just wasn't going to happen this soon. These are a group of private practices. I pretty much do about 4 days of clinic, and then I'll do a day or two here or there where I'll help with running the clinics. So because of my experience in running the residency program, I was able to kind of help out in better managing and better organizing the clinics and structuring them and I guess training assistants, training staff, even working with some of the newer dentists, pediatric dentists. So some days it will be literally just managing administrative stuff, managing clinics, doing a little bit of social media marketing, just structuring the clinic as a whole. And then some days will be consultations, sedations, and then there'll be days of general anesthesia. So we do offer in-office general anesthesia in our clinics to pediatric patients. So those are pretty much 5 or 6 patients a day where they come in. We have an anesthesiologist that comes in. The anesthesiologist obviously provides the general anesthesia. The patient is asleep. I go ahead and complete all their treatments. It's a fast day. It's a lot of dentistry, a lot of drilling, filling, doing crowns. You kind of appreciate the art of dentistry, I guess, those days. And then the other days, I'm kind of doing a lot of behavior management, parent management as well. So definitely day to day, it's very different. Some of it is just dentistry, and some of it is behavior management, talking, educating, explaining. And every day is completely different, to be honest.
I would imagine that it's pretty similar, but I know in the United States, if someone's like going to see a pediatric dentist, they might just be a child, but usually kids go to a general dentist. And then if there's a specific reason that general dentist doesn't feel like they can provide them proper care, then they would refer them to the pediatric dentist. Is that similar for you, that you're seeing mostly patients with like unique needs?
Exactly. So a lot of times it's either, failed attempts at treatment or just complex cases.
Okay. That makes sense. Do you have anything that I don't know, what's kind of like the most intellectually exciting thing about your job?
I definitely think behavior management keeps me on my toes and keeps my mind running because the child is the same. What one story might work with one child, you'll get the exact same age, exact same type of intelligence in another child, but you have to do it a completely different way. So I think the procedures themselves, we do literally a handful of procedures every day, and they're not very, very complicated. You get very comfortable to them and you get very good at them. The only thing that changes is your behavior management. So having to come up with stories, having to relate with the child, having to talk about certain cartoon shows, cartoon movies, keeping up to date with that. I think that's what keeps me kind of motivated to doing my, I guess, job better, is how well I can manage the child. The actual procedure, I think majority of pediatric dentists can agree that they've kind of, after 4 or 5 years of experience, have pretty much reached their peak. They're doing well, the procedures themselves, learning new stuff here and there. But the behavior management never changes. Never stays the same. It always changes every single day. There's a new patient from patient to patient, just literally from 1 hour to the next is completely different, and you cannot prepare yourself for it. So you go in, you assess the patient as you're proceeding, and you modify on the fly.
For like behavior management, do you feel that you learned most of those skills or like different ways to address different patients through mentors, through your formal education, just through practice, like trial and error?
Yeah, so I think dental school is great overall, but pediatrics, at least at our dental school, wasn't in depth. And I think a lot of my colleagues in future residencies agreed as well that their dental school wasn't big on the pediatric education. Maybe now it's getting better, but back then there was a minimal component. So I think coming out of dental school, I knew a small amount of pediatric dentistry. I knew the clinical knowledge, but in terms of behavior management, there wasn't much experience. In my GPR, as well as my pediatric specialty, I got to do a lot of behavior management. And I think a lot of it was learning from your supervisors and your teachers and your faculty, because they were doing this in private practice. And then they would come and say, this worked for this child. How about you try this? And sometimes we'll just be talking at lunch saying, I had a kid that was behaving like this. And then your supervisor will give you their tip or what worked for them. And you literally go and try it on your next patient. So a lot of it is trial and error. A lot of it is just habits. So you realize what worked in the past, and if it's not broken, don't fix it, is the way I think about it. So if it works, just keep doing it until you realize that it doesn't work for the child, and then you start implementing other stuff. A lot of conferences, a lot of CE seminars, a lot of webinars that I've watched since, I guess, COVID started as well. I learned a few tricks and tips from other providers as well. So that's always helpful. So you got to just keep learning, keep introducing new stuff, and then keep trying things that you think will work. And if they don't, get rid of them, try them on another child, but keep trying something new.
So I feel like there's kind of a stigma, but it's probably also true that like you definitely need a particular kind of personality or like mindset to do pediatric dentistry, and that it can be very draining just because you have complicated children all day, every day. And I know you said that you like always knew you were interested in kids and wanted to do pediatrics, but is there anything that you do on days that are particularly tough to kind of get through it?
100%. Yes, you have. I think that's all aspects of dentistry, but we do associate it a lot with pediatric dentistry, where you kind of go home quite mentally and maybe physically drained, but mentally more. We spend a lot of time talking throughout the day. So I use talking as my main behavior management, whether I'm doing sedations or not. So a lot of talking with patients, a lot of talking with parents. My biggest way to relieve myself of that is to not really talk when usually within the first hour that I'm done work. So I try to, get into fitness, get into sports, get into activities. I enjoy the outdoors. I bike a lot. I run a lot. I go to the gym. So put my music on, put my headphones on, and try to, not get involved in too much talking and discussions and heated debates, and just kind of let my mind relax, let my body relax, let my inner, talkative part shut off for a little bit. And then after that, I feel like a new person. So it definitely feels good. I think having a life outside of work is super important for any part of dentistry, but that's definitely what's working for me in pediatric dentistry.
So what's something about your work that's maybe surprised you, or something that didn't go exactly how you expected it to go?
Yeah. So I think the biggest surprise for me, or the biggest, I guess, unexpected thing about pediatric dentistry was that I always focused on behavior management of the child, treatment provided to the child. I always thought about the child. But to our surprise, as I feel like time goes forward, parenting and parents have changed hugely over the last few years. And I think parent management has become an important component of my overall provision of care. So I think I focus a lot on managing the parents, calming down the parents, educating the parents. So I think I wasn't ready for that when I signed up for pediatric dentistry, but definitely something that I have to incorporate in my practice, something that I enjoy on some days, and some days I'm like, yeah, that parent was way more difficult than the actual child. So the child was no problem, the treatment was no problem, but explaining and educating and getting the parents managed is sometimes the challenging part.
Thanks for that. So we are wrapping up, and I do just have one more question that I like to ask everybody because they kind of have different perspectives on everything. And I know earlier you were talking about like de-stressing and balance and everything that comes with work, but how do you think that dentistry fits into the overall goals that you have for your life?
Okay. Initially when I was a dental student, I thought that dentistry was going to be my main focus. I was going to work 6 days a week. I was going to do long hours because I love dentistry. I love the art of dentistry. I love providing care. I love my patients. And I think as I started, my career is when I realized that I think dentistry as a whole, or even work in general, should be part of my life rather than my whole life. And I kind of, with time, realized that and started making changes in my schedule, my day-to-day, my weekly schedule even. And I think that has been the biggest, excitement in my life, is that I'm able to kind of still enjoy life outside of dentistry. And at the same time, when I do go to work, because it's not so overwhelming and not, my whole life revolving around it, I actually end up enjoying work. I actually end up enjoying providing care. I actually end up doing better work as well. So I think having that balance is the most important thing. And I think incorporating it into my life in this manner actually is making me achieve the goals that I wanted overall. Maybe not as a dental student, but overall what I want now for my life is what I'm achieving by these changes.
That's really great. I'm happy to hear that. So just finally, do you have any closing advice or like final thoughts you want to get out to the listeners?
Yeah, for sure. I think throughout dental school, throughout residency, whatever you decide to do, the biggest thing that I was told as advice was be a sponge. Absorb as much as you can. Take in, because you don't know what you're going to end up using and you don't know what you're going to put aside. There are definitely things that I learned or that I absorbed that I don't use anymore. However, majority of the things I somehow get to incorporate into my either life or into my practice, and it's always useful. So as a dental student, as a resident, as a new associate, as a new business owner, just make sure that you're learning at all times. That's the biggest thing I can give, which is either through reading, either through talking to mentors, either through learning from other students or other residents around you. Just try to absorb as much as you can.
Thank you for that. And thank you for everything today. What's the best way for people to get in touch with you if they have more questions? Should they reach out on Instagram?
Yeah, I think Instagram is the easiest. My Instagram is Dr. So Dr.NikhSharma. So it's Dr.Nick Sharma. They can message me there, follow me there, and I'll definitely help out in any way I can.
All right. Thank you so much.
Thank you.
Alrighty, that is the end of our conversation with Dr. Nick. I hope you all thought it was insightful and maybe sparked your interest in looking into some different avenues of dentistry beyond what you have experienced as a patient, and made you realize that there's more out there. There's more you can do if you know you want to be a dentist, but there's different capacities rather than just general dentistry or even working in private practice. There's academics, there's hospital settings. There are lots of people that need our care. So I hope that gave you a little something to think about for the rest of your week. But I did just want to thank you again so much for listening. Remind you to check out the Instagram at Dental Download Podcast and say goodbye for now. I will talk to you next Monday for our D1 fall recap, talking about finals week, talking about my whole semester with 23 credits as a D1 at the University of Michigan School of Dentistry. All right, I will talk to you next week.